Now, I have one more question for you, but it's kind of a loaded question,
Okay.
and it might take some time to answer. It might even take some thought. So, what I would say is either do your best to try to answer, or if you want to think about it, we could actually make this something to ponder and kick off our next podcast with.
Okay.
We got the story of how you are, where you are right now, and we know where you are right now. And most people know the path of Alzheimer's and where it ends up. We know the end game, and there seems to be, in most cases, I don't want to say predictable, but a typical cycle. It seems like the variable is speed, that people go through the process at different rates, but we kind of know the rates. How are you preparing for your future? Where do you see yourself? How do you feel you're progressing? I mean, this is a lot, and I'm not even sure how you're going to respond to this, but where are we going?
Ooh, yeah, you're hitting me with the big one.
And
Yeah,
again,
yeah,
if this is
no,
something you
no,
want to sleep on, that's
no,
fine.
no, because it's pretty straightforward. I think you did articulate some of it well. There is a normal process, but when we start talking about rate, there isn't a normal rate. The process is generally initially a slow decline. Now, the rate of that's the big variable. So that would be where I'm at now, the mild cognitive impairment to mild dementia. That rate tends to be, think of it as a curve. It's kind of slowly coming down. If you think of a curve going left to right. And then all of a sudden that curve starts to drop off. And I'm just going to call it the drop off. And that's where you hit moderate and advanced dementia. And that happens relatively quickly. Once you hit the drop off, things go rate wise relatively quickly. Now, with your question, what's the rate? The rate is variable. It ranges anywhere from 1 to 2 years, and I'm going to start with the drop off to that drop off. To some people, it'll be 15, 20 years. And that's a great question because as I'm sitting there talking with the specialist at Penn, he tells me I have Alzheimer's. One of the first questions when he asks what questions we have, both Danny and my wife say, well, how long? And me being a doctor, I knew the answer to this question. I knew it going in there because I pretty much knew I had Alzheimer's. I just needed it diagnosed so that we could go to treatment, which we'll get to later. And he looked at them and he said, we don't have any testing that tells us how long. There's no test that says this person is going to decline rapidly in 1 year or this person is going to go 15, 20 years. But like I was saying, once that, I call it the drop off happens, it's rapid. So I really don't know if a year from now I'm going to go over that cliff or if it's going to be 10 or 15 years from now. Where am I at, mentally? I'm living it one day at a time. I'm going to do everything I can to try to make that cliff out as far as it is. I tend to be a very realistic person. I'm scientific. I know that cliff is coming. Right now, there is nothing that's going to stop me from hitting that cliff. I'm taking medicine to try to delay that, and we'll get into that later. But, I'm planning my future, and, I'm planning for that cliff. My wife and I have had some hard discussions, and I've had some discussions with the rest of my family. And even you and I have discussed it a little bit because this podcast is going to probably watch me hit the cliff. And, at that point, we're going to have to decide when do I belong here and when don't I. But for me,
I mean, one of the things that we're making clear from the beginning is this will never be about like exploitation or entertainment value in that respect. This is really just to keep people informed and to help family members or people through this. Well, you would know this better than I did. You're saying the conversations with your family, but I'm just telling you from my end, there's no point where this decline is going to be for entertainment value. other than for educational purposes.
Oh yeah, and that's why I've told you I want to show people what the process is, what I'm going through, and of course they're going to see some decline over hopefully the next 20 years. If I'm
Yeah.
the lucky one, if I win the lottery, which I haven't so far, but you always got to buy a ticket, and I've got a ticket for this one.
Can't win if you
That's
don't
right.
play.
So I'm going to play. But yeah, I want to show people it's like the making memories thing. I'm doing things. My life didn't shut down because I got a diagnosis. I'm going to try to make the most out of it. Yes, every 2 weeks I go and I get an infusion. That's okay. But I'm going to work around that. I'm going to do things. I'm going to enjoy things. I'm going to do this. This keeps me engaged. And no, I know you're not going to exploit me, but I, in some ways, want to exploit myself for the benefit of others in the sense that if this shows people that have just found out they've got it, that you can go out and do something. I never thought I'd do a podcast. I never thought I'd be on anything social media. And here I am doing a podcast all of a sudden. This is great. This is giving me something to do.
Yeah.
It's fantastic. It brought me back together with you. So I'm showing people that I'm going to share my life after the diagnosis. And probably one of the funniest things that happened after the diagnosis to share, the end of the Penn story. So we get out of Penn, we're walking outside. The guy has told me, you got Alzheimer's. He said, I'm going to send you down to our lab. We're going to do a test. It's going to be positive, and that's going to confirm it, but it's going to be positive. I know it's going to be positive, and you need to start the treatment. And we're going to get into all the problems getting the treatment started. That's a whole nother issue. But as we're standing waiting for the Uber to pick us up, Danny, my brother, looks over at me and he says, this is the first time in my life I'm happy we didn't have the same father.
Yeah.
And of course I looked back at him and I said, Danny, this is the first time I wish I had the same father.
Yeah. I can't fight genetics.
Nope. This was genetics. And, but yeah, so, that's where I am. I'm at a point where I'm doing things. What I would say is, I have sped up things to do for when I'm off the cliff, for when Portia has to take care of me or put me in a nursing home, but to make sure we have all our affairs in place, that everything's smooth for her. Once again, she's convinced I want to die before you and any of this, but at the same time, we're making our plans, so it's sped that up. I'm doing more. I'm not going to sit on my hands and knees. I'm going to go out and do things. Opportunities come along, I'm going to take them. As many can see on our shorts, I did the trip to Japan with my daughter to help her move. My other daughter in the Navy, we were going to fly out to California and see her fly back in from the carrier, but we couldn't do that because they got delayed. So looking forward to seeing her over the holidays and, maybe going to a football game, taking her to that. Portia and I have already planned a trip to Vegas. She loves Cyndi Lauper, and we've had 2 separate sets of tickets to see Cyndi Lauper for her. And one time Cyndi Lauper's concert got canceled, and the next time Portia had a bad auto accident, which she's still recovering from, and we couldn't go to it. So at this point, I said, we're not going to wait. We're getting tickets, so we're going out to see her in Vegas. So I'm progressing with my life, but I'm doing things as rapidly as I can.
So I know our personalities are similar and different. And I think what's worked in our friendship is both playing off of our differences. But I think one thing we've always had in common is we're both realists. We're both practical, hopeful, optimistic people, but realistic. So I just knowing you and even not being there, I know you weren't in denial. I know you weren't saying not me or anything like that. Or I'm going to beat this. I'll be the first person to beat this. But you also know the science and you know what precautions can help you, what innovations can help you, and what mental attitude also can do for someone. So taking all of that in there and also knowing that some things are inevitable, but some things you can challenge. What was your path from there?
Well, that started the next step, which was now we had a diagnosis. We knew what we were dealing with, and the specialist at Penn had recommended IV therapy for me because I'm early onset. And there's two. There's something called Leqembi and then another one called Kinsala. And his recommendation was Leqembi for a couple reasons, but he said, now let's get you back to your neurologist and see what they want to do. So I went back to my neurologist. He now had the diagnosis, and he agreed that IV therapy was the way to go. And we talked about the two options. First, the Leqembi, which is basically an IV infusion every 2 weeks for 18 months. And then with Leqembi, afterwards, you can continue infusions. Or what I was kind of aware of was that the FDA was going to approve an injectable form that can be done at home. Now, I didn't know how that was going to fit in, if it was going to take over for the 18 months or where it's going to fit in, but I knew that it was going to be a home injectable, and I've used those for my arthritis and for my diabetes, so to me that was also a good option for the Leqembi. The Kinsala had an advantage that it was an infusion once every month, so every 4 weeks, and that was for a year. And then they would do an MRI and look at the plaque load in the brain, the number of plaques in the brain, and determine whether or not to continue it. A little less clear on whether or not continuing it would be helpful.
I was there with you for your first infusion, and if anybody had missed it, we have a video with the reunion where we kind of talk about how we got back together and about the initial treatments. And so you explained in that video what the treatments were doing, but just to clarify, or for anybody who missed that, what is Leqembi and what is it doing for you?
Okay, so the Leqembi is a monoclonal antibody, and it basically binds to the amyloid. So it binds to both the amyloid and the plaques, and it binds to a smaller soluble version of the amyloid that's in the spinal fluid. And then your body removes that. So it's helping remove the plaques and remove the amyloid that deposits, and basically slowing down the decline. So earlier we talked about the decline being that slow, mild cognitive impairment to mild dementia, and that's a slow process. And then you go off the edge, and the moderate and severe is more of a cliff type of scenario, and things go faster. What the Leqembi and the Kinsala both do is they try to delay that change from the mild and cognitive impairment and mild dementia going into the moderate. And most research is indicating, and I'm going to rough estimate it, about 25 to 30% delay. So let's say, for example, you're someone who's going to get a year and a half. Maybe you get a year and a half to 2 years before you go to that moderate decline. But once you hit that moderate decline, the IV therapy, at this point, there's no, they don't continue it because there's really no data that suggests that it does anything at that point to help you. If you're someone who's got that, 10 to 15 years now, maybe you're looking at 15 to 20 years, so you're doing the infusion to just try to delay that time from going slowly through the mild cognitive impairment and mild dementia to where you go to the rapid, moderate to severe. And the Kinsala, on the other hand, is a monoclonal antibody, but that one attacks just the plaques, and it removes the plaques. It's really hard to tell. Everyone should talk to their doctor. I think there's pluses and minuses to both. I was more inclined to go with the Leqembi for a couple reasons. It's got two mechanisms of action. It had the injectable, which I had been hopeful would allow me at some point during the process to switch to home injections rather than going in for the infusions. I found out just about a month ago that now what they're doing with the injectable is that's going to start after the 18 months of infusions. So I'm going to get the initial 18 months infusions every 2 weeks. and then I can switch over to the injectable after that for my maintenance. So that's still a plus. I don't know. Maybe in the next year, before I'm at my full 18 months, maybe they'll say, no, the studies are showing that it's just as good as the infusion, so you can switch from infusions to the injectable. But I know at least at the end, I can switch from the infusions to the injectable. Now, the infusions, the first one takes a while. It was like a 3.5 hour process, and thank God you were there with me. It was nice having you there. It was comfortable, and unfortunately, Portia had the auto accident, and she really couldn't go. So, this really brought us back together. And, if there's some of the positives with having this is one of them, and this is one of the great positives. But you sat there, it was a lot of technical stuff and a lot of slow, see how I was doing, pre-medicate. After that first one, when I went to the second, the third, the fourth one, we're now at the point where I go in there and it's an hour and a half. It's about 10, 15 minutes of them getting me prepped, about an hour of it going in, and about 10, 15 minutes for them to get the IV out, me to sign the paperwork, and to walk out. So it's a much quicker process than the first time we went in. Side effects, I've really not had anything significant with it. I do find that the day of, I'm a little sleepy. Sometimes I come home and get a nap. And I don't know if some of that's because maybe I'm not sleeping as well the night before, or maybe it is the medication. I'm not sure what the true cause is, but I do find that I either have to nap or I go to bed earlier. The other thing that I get is just a little bit of nausea that night. Not a lot, but just a little bit of nausea. So it's good for my diet. I don't eat as much at dinner that night. So that it's not a weight loss plan that I would suggest for anyone, but hey, it works for me for one night a week, one night every 2 weeks. People want to know, okay, so what are the real major side effects? There's one real major side effect, and that's called ARIA, ARIA. That is amyloid-related imaging abnormalities. And there's two abnormalities that they're looking at, and this is when they do an MRI to look for them. One is ARIA-E, which is ARIA with edema. That's just some swelling in the brain. And that's just looking for a fluid buildup in the brain. And then there's ARIA-H, which is basically microhemorrhages in the brain. And those are real small hemorrhages. Interestingly, when I was speaking to the specialist at Penn and we were talking about the medications, he said microhemorrhages are not uncommon in people with Alzheimer's anyway because of the plaques. So it's hard to really determine if it's specifically due to the medication or if it's part of the process. But they know it's seen with the medication, so they have to look for it. And there's a procedure, and I don't know it for Kinsella, but I do know it for the Leqembi. The Leqembi, I had an MRI before I started therapy to make sure there was no swelling and no microhemorrhages that they could tell. Then I had one before the 5th infusion, and thank God it was normal for me. Then you have one before the 7th infusion, which was the one that, if you want to look at the shorts, it's the one where I was stressing because we were into Thursday before I actually had a reading on that, and I had my infusion on Friday, and without the reading, I wasn't sure I was going to get my infusion, and I had the test done on Monday. Well, it went into quality review, and they got it done in time, and I got my infusion. But luckily, that one was normal. And then before my 12th infusion, I'll have one more MRI. And then at that point, if that one's normal, I won't have any more MRIs unless I have symptoms. Now, that would be side effects. And that gets us into, okay, what are some of the side effects? Well, if you're having microhemorrhages, you're having some swelling of the brain, it's confusion, it can be headaches, it can be nausea, a little bit more than just like I have a mild nausea after I have the infusion, but constant nausea, some visual abnormalities, some mood, significant mood changes, those are things that you as the patient and your family need to be aware of, because if they notice any of those are truly a medical emergency. And in those cases, you get right into an emergency room. So it is an infusion. I wear an identifier on my ID bracelet that, I have on there my diabetes, I have my Humira, which I take for my arthritis, and I have Leqembi therapy, because if they think it's a stroke, they got to make sure it's truly a stroke, because sometimes with stroke you give blood thinners, and if I'm having microhemorrhages, blood thinners could worsen those and things could get worse dramatically. So it's very important that when you're on these therapies, your family knows, and that you have an alert bracelet or something saying that you're on Leqembi therapy, so that the ER or emergency personnel are aware that you're taking that medication and they have that information. But those would be the side effects. That's the treatment. I'm about to have my 8th treatment. I've done very well with it. I haven't noticed any significant decline over the 8 weeks. I don't think I've had any improvement. I've heard stories online where people have said, yeah, my significant other or I've noticed some improvement, with the Leqembi. I'm not that far out. I mean, I'm so early in the diagnosis, I'm really not noticing much. I still kind of struggle with what I was struggling with, but my struggles are on the mild side compared to the average patient taking Leqembi. So for that, I'm optimistically hopeful that my decline will be significantly delayed, and that maybe I'll be lucky to be that 15 to 20 years and I'll get, 20 to 25. And if I am that 1 to 2, maybe I'll be lucky and get 2 to 3, because I'm catching it so early. That 1 to 2, that 5, 10, 20, that's all based on when people are diagnosed. There's really nothing to say, hey, we know on a microscopic level you started this, 2 years ago, 5 years ago. That's not what they're talking about. That's talking from diagnosis to those declines. So I am so early in the diagnosis. I think even if I'm a 1 to 2 year, I'm going to be optimistic that I'm starting off probably a little longer, because I don't necessarily know if I walked in as the average person working that I would have noticed something beyond, hey, I'm just struggling. Like you said, it's just age related. And that's what I was told by the specialist. He said, you just were in such a highly skilled job that your fear of hurting patients was enough to make you search for an answer. And I was very fortunate to have a neurologist and a psychiatrist who wanted to dig deeper and found it for me. So those are the therapies. They're not for everyone. There are some people that may be older who don't want to do it. There are people that have the fear of the side effects. I tend to be of the type, I fear the decline more than I fear the potential side effects. I'd rather try to delay the decline. If, we were talking earlier about the MRIs that I have during the therapy, if they find some edema or if they find the microhemorrhages, then what they do is they just delay the therapy until they resolve. And generally, I've been told, for the few cases that they've seen it at Penn, they resolve and then they restart the therapy. It's not even a case of it's, not indicated. Now that brings us to another indication and things that you want to check when you're getting the therapy. There's a gene called APOE4, and that's a gene that's associated with Alzheimer's. And some people have that gene, and that's where they get a genetic form of Alzheimer's. And some people don't have the gene, and we just get Alzheimer's, and still trying to figure out why that happens. But they do know people who have the APOE4 gene, particularly two of the genes on both chromosomes, your mother and your father's side, have an increased risk of having the side effects with the Leqembi and with the microhemorrhages. Now, in my case, when my neurologist at Strong, he did the blood work. He did a blood test for p-tau, which wasn't authorized up here. That was another test that our people up here. And I said, yeah, I'll just pay for it. That was elevated. And he said the blood p-tau shouldn't be elevated, but it's sometimes elevated earlier on than the CSF. And sure enough, that was mildly elevated. And that was the diagnostic part that he knew was going to be elevated. He said he thought it might be a little more elevated than it was, but he said it was definitely elevated, and it definitely confirms what he said I had. And then he also did the APOE4 gene testing. And I was what they call heterozygous. And heterozygous is where you have one of the genes. So on one of my chromosomes, I had the gene, and on the other chromosome, I didn't. So in my case, most likely I had it on the Y chromosome from my father based on his history. And then that brought up the question, should we test, should my daughters be tested or anything? And the doctor at Strong said, no. One gene, no family history on my wife's side. It's highly likely it's on my father's side, on mine. He said, you gave your daughters an X chromosome, so they did not get that gene. And unless they're having problems, they shouldn't be burdened by it. So I had one of the genes, which makes me at a slightly increased risk compared to people who don't have the gene, taking the Leqembi and getting the side effect of the ARIA-E or ARIA-H. But knock wood, I haven't had it. If I had two of the genes, there's a higher risk. But I've got to be honest with you, I would have done it anyway. I'm young. Maybe if I was in my late 70s, 80s, had more medical problems, I might not have done it. But at this point, I've got a good mind. I haven't had any strokes. Even with my chronic medical problems, they're relatively well controlled. I do have a lot of discomfort with the arthritis, but hey, I can live with that. So to me, it's more important to maintain my brain function as long as I can. So I said, let's go forward with it. And we decided to go with the Leqembi. Now that brings in welcome to insurance and welcome to me being on the other side of medicine. So we contacted, I shouldn't say I'm using the royal we, my neurologist contacted the local insurance company and tried to get authorization for the Leqembi. And they basically said, nope. And he said, well, no, we have this test, that test. Well, a PET scan would be more definitive, but we don't have anything to authorize a PET scan. So it was a catch-22. They wouldn't do the PET scan because they didn't have enough information to authorize the PET scan, but they wouldn't give me the Leqembi until they had a PET scan. And that was the initial process. So they said, okay, well, let me try to get the PET scan authorized and we'll try to order it. And then when his nurse went to get the PET scan authorized, they said, well, it doesn't matter because we don't cover Leqembi anyway. And I said, well, seriously? They consider it an experimental drug. So, of course, now I go and I Googles it. It's time for me to get on Google and say, what? This is FDA approved. I mean, it had just gotten FDA approved about a month before I got the diagnosis. And now we're another month out. Actually, we're more like 6 weeks. So now it's 2.5 months since I get the diagnosis. And I'm like, come on. What's going on? And I found out that if I was on the insurance plan under Medicare, Medicare has authorized the use of Leqembi. If I was on the insurance with Medicare, they'd have to give it to me. But because I'm on private insurance with them, they don't have to, and they still consider it experimental. So then it dawned on me, I get a lot of my medications through the VA. And let me say, I know a lot of people have negative thoughts of the VA. I have had nothing but great experiences. Yeah, there's bureaucracy like everywhere else, but they've been very helpful. So I contacted my primary care at the VA and said, hey, look, I've been diagnosed with the Alzheimer's. I want to start Leqembi, but my private insurance won't cover it. Does the VA cover it? Now, I had done my research and I had found out it covered it. The VA does cover it. But, and in fairness to her, she emailed me back, I'm not sure, I'm going to have to look into this. And I emailed her and said, yeah, I did some looking and it is on the list. So she emailed me back and she said, well, you're seeing your private neurologist. Yeah, if he orders it, we should be okay and it should be covered. I'm like, great, here we go. Now we're rolling. So I contacted the infusion center and I contacted the neurologist and I said, okay, the VA actually covers it, but you have to order it through the VA. And then they said to me, well, yeah, we have a couple of VA patients on it, but we've never ordered it through the VA. They've been referred to us. I'm like, okay, well, they said you just have to order it. So they contact the VA and they contact the pharmacy and the pharmacy says, oh yeah, Leqembi's covered. And they start getting everything rolling. And then all of a sudden, when they go to order the Leqembi from the VA says, well, it has to be ordered by a VA physician. It can't be ordered by a community physician. Well, here we go. Back to delays.
There's your bureaucracy.
There's my bureaucracy, right? And there's me being on the other side, being the patient. And I've been the advocate for the patient as a doctor, and it's frustrating for me. And boy, I'm learning this side. So I called the neurologist and I said, hey, look, we've got to get one of the VA neurologists. I've got to see when I can see a VA neurologist. And I knew that was going to be a problem. Well, fortunately for me, the VA neurologist was one of his old partners who semi-retired and was working at the VA. So he said, oh, my old partner is the neurologist at the VA. Let me give him a call and let's see what we can do. So about 48 hours later, he calls me back. He says, John, we're in great shape. He's going to order the Leqembi. It's going to be all taken care of. Let's reschedule you for next week. So to make this long story short, the following week was when I was going to get, the Leqembi, which was a week and a half. I should say it was like a Thursday. He said that Friday. And that's when I called you, and that's when we kind of got back together, and you were here for my first infusion.
Now you've really shared a lot, and we've covered a lot here. I think I just want to put you on the spot one more time, although this might be even more on the spot because I'm not just asking you to recount something here, but off the top of your head.
Okay.
Here. How about we break the fourth wall, and why don't you close out our initial podcast by talking to our audience and just giving them some final words on your condition and where we're heading as a team here.
Well, we are going to be basically chronicling my process through Alzheimer's, the things that I do, the things that I can't do, the treatments I go through. We're going to be sharing information, data, and we're going to be sharing Bill's story with his colon cancer and his recovery, and advocating for colonoscopies, advocating for people to get testing for Alzheimer's if they have concerns regarding memory, see your doctor, and showing you that, yes, this is, for lack of a better term, a terminal illness I have, but it doesn't mean I'm dead and I'm not going to do things. And we're going to share my journey, and I hope it's inspiring. I hope we can educate. I hope we can inform you, and at the same time, I hope we can entertain you. Thanks for watching our podcast. If you or a family member has concerns about your memory, please contact your physician, and there's great resources at the Alzheimer's Association website where you can get information about memory loss and resources for helping take care of yourself and family members who have Alzheimer's.